and welcome to this HTA webinar, a renewed HTA competency framework, reflection from HTA Master programs around the globe. As we wait a few moments for further participants to join, I will share a few slides with you about the society. HTA is the only global society championing equitable, responsive, and cutting-edge health technology assessment. Our members are a community of multidisciplinary advisors, academics, scientists, and professionals. HTA membership holds many benefits, including premier events and specialized interest group, free online access to the International Journal of Technology Assessment in Healthcare, HTA resources and news, including newsletter, bulletins, and international developments in HTA, and many other resources. Our interest group are open to all members of HTA. They act as a forum for HTA members to network, exchange information, and collaborate on projects of mutual interest throughout the year. Visit our website for more information on our interest groups. The next HTA 2025 annual meeting will take place in Buenos Aires, Argentina, from June 14 to 18. If you want to know more information and details, please visit the event website. We kindly ask you to remain muted until invited to ask questions. You can also submit any question to our speakers through the Q&A function of the Zoom meeting platform. Thank you again for joining us today. I will now hand over to the chair of this webinar to formally welcome and introduce today's topic.
Thank you so much, Nicola. So welcome everyone to this HTA webinar. My name is Leia Oortwijn. I am senior lecturer in HTA at the Radboud University Medical Center based in Nijmegen. I'm coordinating the courses Introduction to HTA as well as Values in Doing HTA, which is part of our master program in biomedical science at the Radboud University. And I'm also the current past president of HTA and still at the board of HTA. And I'm very happy to present to you this webinar, or chair the webinar actually. And the webinar is about presenting a renewed framework for HTA competencies. And we will hear reflections on that competency framework from three master programs from different countries around the globe. And these master programs are also included in the HTA educational offering database. So if you're not aware of that database, you might want to check out the HTA website. The aim of today's webinar is to present the renewed framework and to hear reflections from three established HTA master programs around the globe, with the aim to review the usefulness of this competency framework for education and training HTA professionals, but moreover also to learn from each other and to see how we can enhance HTA training and education across the globe. We have been trying to collaborate since some time. We were supposed to have a session during the HTA meeting last year. Unfortunately, that did not happen. So I'm very happy that we have this webinar today. And I would like to first introduce the first speaker, which is Lisa van Mun. Lisa is a PhD candidate at the Radboud University Medical Center in Nijmegen. She's focusing on education in HTA, and her PhD research is part of a European-funded project called Sustain HTA, which aims to upskill the HTA workforce and also to harmonize HTA capacity. And she will present the work that we are currently undertaking, and the renewed competency framework is part of that. So without any further ado, I would like to give the floor to Lisa. And just Lisa, 1 second before I give you the floor, please, indeed, if you have any questions, post these in the question and answer chat, and we will answer those questions at the end of this webinar. Thank you. So Lisa, the floor is yours.
Thank you for the kind introduction, Maya. Like Maya told you, I will tell you something about the development of the renewed competency framework for HTA expertise. Imagine having a garden. What happens when you flower the garden? When you water the flowers, when they get sunlight, when you give it the right attention, your flowers will flourish and grow. And just like flowers needing attention, HTA experts also need attention to grow and flourish. Therefore, we renewed an existing competency framework which guides the development of an HTA expert like a garden guide. It shows which competencies are required for each health technology assessment professional, element, and level of expertise. And this framework can be used for capacity building, resulting in increased and improved HTA expertise around the globe. But why do we need capacity building in HTA? So first of all, HTA processes are evolving around the globe. And also the implementation of HTA varies based on the region and the country. To effectively address these changing processes and the varying implementation, capacity building plays an important role. Capacity building in HTA is to develop or strengthen competencies related to the understanding or the performance of HTA. And for capacity building, we want to define clearly defined competencies. And the European Project Sustain HTA is also addressing this need by defining competencies and enhancing and harmonizing HTA capacity. And therefore, we will look into the competencies and how we define these into a competency framework. So the competency framework is made on 3 levels of expertise and is aimed at organizations and individuals involved in HTA. So the framework is based on the foundational work of Müller et al. From 2020, and they developed a competency framework describing competencies for individuals and distinguishing on knowledge, skills, and attitude. We decided to update this framework, and also add 3 levels of expertise. First of all, we added the level competent. This includes explaining concepts or ideas. The proficient level includes using information in new situations and drawing conclusions. The expert level involves evaluating decisions, information, and also creating new work. And by using these 3 levels, we are able to fit HTA competencies to different roles based on the requirements of the professional. Because roles can differ based on the context of the HTA professional. For example, on jurisdiction, but also an HTA body and the role of the HTA body in the country or the region. And also the evaluation and decision framework has an influence on the context. And it's important that our competency framework is developed on a broad or general level, so adjustments can be made based on the requirements for the individual professional. And also, as we made 3 levels, it's not per se necessary that one expert is an expert level for every competency. So for example, an ethics expert does not have to be an expert on, for example, economic evaluation, but it has to be an expert or an expert level on ethical analysis. So this is important to keep in mind when seeing the competency framework. And if we look into the purposes of the framework, there are 4. So first, it can be used for workforce development for individuals, but also for organizations so they know which people to hire. The framework can also be used for training and learning to develop education and also so students know what they need to learn. Thirdly, we can use the framework for credentialing of individuals, teams, and organizations. And lastly, the framework can be used for assessment of students, organizations, but also for self-assessment of individuals or teams. So now I will tell you something about the development of the competency framework. So we used a model for developing competency frameworks in healthcare professions by Bott et al. And based on this, we performed a scoping review of Korean scientific literature to search for competency frameworks, articles describing competencies, and tools assessing competencies. And we also reviewed the websites of HTA and other relevant professional societies to find any frameworks or competencies. And in this scoping review, we included 19 records. And the competencies that were described in these records were mapped using a deductive content analysis with the original framework as a codebook. And this showed that the original framework mapped appropriately to the newly identified literature. And we only identified some additional competencies and 2 new domains, but I will explain this to you later. And these are the several steps we took for the development. So we started with the competencies in Müller et al. Then we divided these into 3 levels. We discussed the levels internally, and we also did a verification with Dr. Müller. We developed the competencies for the remaining lower levels. We improved consistency, we refined the wording and added keywords. And currently we are doing a Delphi exercise with experts to validate the framework. And thereafter we will do a validation to see whether the framework is also suitable for people on the competent level. This is the original framework by Müller et al. And here you can see that it's divided into 2 parts. So one part about the HTA domains, which are based on the UNETA core model, and one about the HTA processes, which was identified in her literature search. And for the development or the translation of the competencies into 3 steps, we used Bloom's taxonomy for learning objectives because we thought it would be suitable for the competencies. So competent level consists of the remembering and understanding, proficient level of applying and analyzing, and expert level on evaluating and creating. And here you can see an example of the patient and social aspects about how we translated these. So here now you see the original competencies of the framework of Müller. And here you see how we translated it into 3 levels by using the same words every time. So understand, analyze, and evaluate. And we also did this for the other competencies. And in the end, this was the end result. So we also added some words or some explanation to make it more clear. And we also added keywords and developed the other levels. And now I want to show you the renewed competency framework. Although I will not show you the complete framework because it contains a lot of competencies, so then we need way more time. So I will only show you the domains and the changes we made to the original framework. So here you see the original framework again. And we added some domains on environmental aspects and AI use in HTA. So we added environmental aspects because this was mentioned in the UNETA core model and also in the discussion of Müller et al. Already. And we also added a domain about artificial intelligence use in HTA. So for AI use for performing HTA, for example, for literature review, etc. Because this was included in the scoping review and also mentioned by stakeholders in our network. And you also see the performance and achievements domain here a little bit more transparent because we are not sure yet whether we want to add this. And this is currently asked out in the Delphi to see whether it's relevant for an HTA competency framework. And like I said, we also added some separate competencies, so not domain, but a competency. And here you see them. So about patient and public involvement, sustainability was added. We also added a competency about stakeholder identification, writing and analyzing an HTA report, and also the use of real-world data and real-world evidence. So the next steps we are going to do include performing a Delphi exercise, which we are currently doing. And after the Delphi exercise, we will do a validation with professionals with less than 3 years of experience. And if you want to participate in that, then please scan the QR code at the end to provide your email address so we can email you. And for now, we will use the framework for course development in Sustain HTA because we can assess gaps in competencies, and also we are assessing training needs. And then we will see what trainings need to be developed to make tailored trainings. And it will also help in capacity building by demonstrating which competencies are required for each HTA element and level of expertise. And the competency framework can be compared to a garden guide or garden material, water and sunlight, and will hopefully help HTA experts around the world to grow and flourish just like beautiful flowers. So I'm very curious about the opinions of the speakers and their reflections on the competency framework and the usefulness for their master's program and capacity building initiatives. But first of all, I'm curious about what you think about the usefulness of the competency framework. So please vote in the poll that should be appearing soon. And thank you for your attention.
Thank you, Lisa. So thank you for your presentation, very insightful. I see the poll is up and running. And I see also one question in the chat. The question is a question for clarification. Recently, I have received an email from different interest group asking for participating in an online survey, but I am confused. Are you looking for more than 3 years of experience or less than 3 years experience, Lisa?
That's a good question, thank you. So for the Delphi exercise, we're looking for experts with more than 3 years of experience. And for the validation that will come afterwards, we're looking for people with less than 3 years of experience.
Yeah, so the Delphi more or less is closed, no?
Yeah, it's closed.
Yeah, so the QR code that you will show or did show will only apply to those with less than 3 years of HTA experience, right?
Yes.
Well, I don't see the poll anymore, but maybe you do. So
I can see it.
okay.
So I see that 42% voted that it's very useful, and 37% that it's moderately useful. So I think that are nice results, and I'm very curious about the other speakers here today about what they think of the usefulness.
Thank you so much. So I think we move to the next speaker, although, okay, there is another question which I will leave for the end. I like to move to the next speaker indeed to hear their reflections on the competency framework. And we start with my esteemed colleague from Thailand, Yusa Chai Ket Kao. She's an associate professor at the Faculty of Pharmacy of Mahidol University in Thailand. And she's also the founders of HTA, all very known to us. And currently she is the director of postgraduate program in health technology assessment at the Mahidol University. And she was also heavily involved in establishing the HTA guidelines in Thailand. So thank you so much for accepting the invite, Yusa, and we are looking forward to hearing your views on the competency framework. Thank you so much.
Thank you very much for your kind introduction, Dr. Vaya. Please let me share my slide here. Good day, everyone. I'm very pleased to share the reflections from master degree program at Mahidol University Health Technology Assessment Program in Thailand. And the outline of my talk, I will start with give you a brief introduction of the MUHTA and also reflections on the renewed competency framework, especially on the usefulness for our program and work, and also impact on the capacity building in HTA. And at Mahidol University, we established since 2017, and the reason that we established MUHTA that we started to have the universal coverage since 2002, and since then we try to use the HTA for the policy decision making. So we established HTA, which is the HTA organization in Thailand in 2006, and since 2008 until now we have been used the HTA in Thailand, and we have very long experiences in using HTA in our country. So after almost 10 years of experience, we established the Mahidol University HTA mainly to provide the scholarships to staff from the HTA-related organization in low and middle-income countries. And the reason that we established our program, we got the support from NICE and Mahidol University in 2015, and also we linked it with the Ministry of Public Health, HTA, and academic institution in Thailand, and also we also received support from the national and international networks and committee. Our vision is to be the world-class graduate program in HTA for low and middle-income country, and our mission is to build up the social and intellectual capital on HTA for LMIC to support priority setting in achieving universal health coverage. And teaching and research strategy, we use the experiential learning, also hands-on experience, and we also invite the renowned expert, for example, from the University of York, and also Professor Olivia Wu, who is also adjunct professor at Mahidol University from HTA, University of Glasgow, to give a lecture and also provide the guidance on their thesis. And their research question are the real world research question from the policymaker in the LMIC, and also their dissertation topic. After they're done, they can use for the policy decision making. And the objective of our program is to provide the student with critical understanding of the entire process of HTA, and also provide the student with real knowledge and or the research skill, mainly for the LMIC. And during 7 years that we established our program, we have about 34 students and alumni, and some of our master students are now is the division chef in the HTA related organization in their country, like in Philippines, Malaysia, and also in India. And from example, from our master student, who is the division chef of the HTA division, her publication also have been used in her country for the policy decision making related to the trastuzumab therapy for breast cancer diseases. Not only we build up our graduate student, we also provide the training in other countries like Nigeria and Kenya. Right now we expand to provide a scholarship to the students in the Africa region, like Nigeria and Kenya and Ghana, and also we have the collaboration with the National Health Insurance Authority, and also we also have the research collaboration with the University of York. And also we invite our visiting professor like Professor Olivia Wu and also Professor Jasmine from Fujian Catholic University to provide training related to the application of real-world data in our country. So for the competency framework, when we develop the master degree program, we align with the Thai qualification framework, or we call TQF, and you can see that we have like 5 domains to comply. For example, morality and ethics, knowledge and intellectual development, interpersonal relationship and responsibility, and also math communication and IT skills. And our program, our master program is about 2 years program and 12 credit for required course in the subject are in the black text, and also the elective courses are in the blue text. And we based on the coursework, and the student need to perform the thesis for 1 year or 12 credits to complete their master degree. And when we look at the all the required course and elective course, we also mapping with the Thai qualification framework. And you can see in the red box here is also similar to the Renew HTA competency framework, but we map with the in the subject level, not the topics level. And the usefulness of for the Renew competency framework for our program, I think the newly proposed competency framework aligns closely with our program. And also you can see that TQF evaluates competency at the subject level, not at the topic level. So by using the newly proposed competency framework, we can allow granular assessment of competency for each topic, and also enhance the precision and effectiveness of HTA learning outcomes. So we think that this approach ensures that students achieve proficiency in key area of the HTA, creating comprehensive learning experiences. And after we read more adopting the Renew competency framework, we also map with the topic that we has been taught in our program, and we also do the check if it's aligned with our program in the competent level, proficient level, and also expert level. And in the domain 1 and 2-5, we also align with this newly competency framework. And we also do all the domain, and we have the summarize here that the newly identified items are quite useful for our program. In the expert level, we still lack of the methods for ethical analysis, organizational aspect, patient social and cultural aspect, and legal aspect, and also environmental aspect. And these knowledge can help us to provide more in the expert level for the methods to evaluate this issue. And also at the proficient and expert level, we still also need to develop the health technology reassessment and post-market review, and also the qualitative data. And because we provide only the knowledge, but not still in the proficient and expert level. And also for the AI in HTA, we still not provide the knowledge on the in competent, proficient, and expert level yet. So I think this topic will be incorporated in our program in the future. However, for the existing offering in our program, I think in the expert level, our program also provide writing and referencing skill, evidence synthesis, systematic searching, as well as we also provide in the proficient level for the definition of HTA, HTA application, basic of HTA, evidence-based medicine, HTA study, and also study design. And also PICO, because we have the content, we have the subject on the systematic review and meta-analysis, and all the students need to perform the meta-analysis study. So I think we reached the level to the expert level for in this topic. So the reflection on the impact on the capacity building in HTA, we think that the newly proposed competency framework for HTA plays a pivotal role in improving HTA education and capacity building. First of all, it helps standardizing skills and knowledge. And we have like clear benchmark for essential HTA competency, and also help us design the structure of the HTA curriculum to ensure that our master students have required skills systematically. And also enhancing the multidisciplinary collaboration. The competency framework ensure that all relevant areas are covered. For example, that Lisa provide the item, the environmental aspect, that we also need to promoting the collaboration across the disciplines. And last but not least, the newly proposed competency framework will provide the universally applicable structure for the international compatibility of the HTA competency that we can compare with the HTA and also from the Argentina, and also all the HTA. Finally, we can compare all the HTA competency around the globe. And I think that would be all from the Thailand Mahidol University HTA program. Thank you very much.
Well, thank you, Yusa, for a very interesting presentation, and I'm happy to see that the framework appears to be useful, at least also for an assessment of your own program, and to identify maybe areas where you might want to adjust or invest in. So great to see. So we are a little bit behind schedule, so I'd like to move forward with the presentation of the colleagues from Glasgow. I'd like to introduce the co-directors of the master program, Health Economics and Health Technology Assessment of the University of Glasgow. So that's Dr. Claudia Goya and Dr. Eleanor Grieve. So the floor is yours, co-presenting on your program. Thank you so much.
Thank you, Aya. Yes, so Eleanor's just sharing our slides, and we'll both be presenting our reflections on the competency framework. But we thought, similar to Dr. Usa, we start with just an overview of who we are as a team. So the Health Economics and Health Technology Assessment team at the University of Glasgow has been around for nearly 20 years. I think we were established in 2006. We currently have just over 30 staff members. We do have around 15 PhD students at any one time. And we are a very international team in general. And so we are very research focused. We are an academic research group, and also supported by our professional services team. So very similar to our team, our MSc in Health Economics and Health Technology Assessment also attracts a very international audience in terms of students from across Africa, Latin America, Canada, Europe, but very few UK students actually. So the program was launched in 2013, and then we've been fully online and part-time since 2015, so that's nearly 10 years. We do offer 3 different degrees, so PG certificate, a postgraduate diploma, and an MSc, each of them requiring a different number of credits. And at any one time, we have about 35 students who are enrolled in our programs. Looking at who's enrolling in our programs, down here at the bottom, most of our students are professionals, so they are working while they are undertaking the MSc or the PG Cert or PG Dip part-time. And majority of them seems to be working in private industry or pharmaceutical companies, consultancies, health insurances. So this is part of a survey we did amongst alumni and current students last year. And we also asked them to rank the modules that we do offer in terms of relevance to them. So this just kind of before we kind of looked at the competency framework, I thought we show this just to give you an idea of the modules that we do offer, and also how students past and current rate our modules in terms of relevance to them. We also asked them for additional modules or areas they would like to see covered that are not currently offered, and here are some examples of the answers we got from students. So it seems kind of centered around methods a little bit. And yeah, so the next slide then kind of moves on to just looking at the competency framework a bit closer. So we found it very useful and helpful to distinguish the domains in the competency framework between kind of more what we would call HTA submission elements or process, and some kind of more methodological domains. So we as academic researchers, we are more involved in applying and developing methods, and our teaching is very much research-based. So the focus of our teaching is on methods, and we feel that's where our expertise lies, rather than the kind of more frontline HTA agency or farmer perspective. So this is the approach that we took when we looked at the framework and kind of trying to position ourselves and position our program within that.
Thanks, Claudia. So yes, I'm just going to quickly go through that mapping that Claudia talked about. So just to clarify this very busy slide, and I'm not going to go through it all for the sake of time, but our modules are along the top here in the darker green and the white writing. So we've got HTA policy and principles, health economics for HTA, etc. And then the domains are underneath. So it's not an exact science, but it actually highlighted a few key things for us. So firstly, I'm not sure if the domains were any kind of in sort of any sort of hierarchy of priority, but it's perhaps quite fitting that our first core course that we offer maps quite well onto domains 1 and 2 around the health problem and what data is available and technologies, and around the definitions. That seemed to fit quite well. And then our next core course that we offer is on health economics for HTA, and that mapped very well onto domains 4 and 5. Domain 3 on safety is missing, and we don't actually teach anything on that. So that could well be around that, you know, safety is assessed at a sort of when a drug or a technology is commissioned at a higher level, and then we are looking at the HTA process, but that's certainly an aspect that was missing from our teaching. Moving on to HTA in a global context, that mapped quite well to some of the added domains that have been included on health systems and different practices around the globe, different health systems and different HTA structures, etc. Qualitative research methods mapped very well onto domain 8 around stakeholder engagement and synthesis of qualitative evidence. I'm just going to skip down to choice experiments. You can see here in the red. So this was an area where I don't think I saw discrete choice experiments mentioned. I might have overlooked it, but certainly that's one methodology that we teach that I couldn't see in the framework. And we also happen to have focus that teaching around One Health, so that recognizes the interconnection between people and animals and their environment. So that was just two aspects that we sort of found in our teaching, but wasn't maybe reflected in the framework. But I could just have missed that. But certainly, there are aspects on the framework that are missing from our teaching. And so I've mentioned safety. Domain 3 is missing. Domain 6 on ethical analysis, we didn't seem to be very strong on or teach specifically. However, I should probably have added that to the generic skills on the bottom right-hand box, because understanding ethics is a prerequisite for all our students. So it's a really important topic and something that students need to understand, but it's not, we don't specifically teach ethics in relation to HTA, if that makes sense. And also domain 9 was missing on legal aspects, which we don't particularly cover either. So just moving on to other domains and aspects that were mentioned. So as we all know, HTA is continually evolving, and that means we're continually renewing and adapting our teaching materials accordingly. So methods for environmental aspects, that was again an added domain to the framework, and we're adding a lecture on environmental aspects relevant to a technology as part of one of our core courses, introductory core courses. So that's a little bit more covered there, and also mentioned that we do have teaching around One Health as well. So that's includes the environmental aspects. We have a new course that we're offering from next academic year on more on a sort of in-depth look at research study designs and how they're applied in HTA. And so domain 7 on analysis of implementation issues in HTA will be covered in that, looking at value of implementation, looking at our links of implementation scientists in the wider school that we work in, and including implementation costs, etc., and economic evaluations. So we're sort of mapping more of the aspects in the framework to some of our new developments. And then finally, just to wrap up on a little bit about capacity development, accessibility and inclusivity. So the Athena Swan is an award that celebrates equality, diversity and inclusion. This is a UK accreditation for higher education institutes. And so we work with our students to review our materials and make sure that our teaching is reflective of the very sort of diverse international cohort that we have. We're also aware that our teaching, in particular on MSc HTA, is purely online, and so we're very aware of student belonging. We try and make them feel part of our team, inviting people to seminars, particularly when students are doing dissertations online, they can feel at a distance, so there's sort of wider activities to provide peer support at that sort of final level, final stage. Capacity development, so under this I've included the sort of more commission teaching that we're asked to do, and that could be to ministries of health or to the pharmaceutical industry. And I think that reflects quite well the different competency levels. So, and that was quite useful to see in the framework, because our students were teaching sort of methods and research and actually carrying out economic evaluations, for example. Whereas in capacity development to ministers, it's more about being able to appraise and not actually need to carry out the methodologies. So that was quite a good distinction I found on the framework, sort of the different roles of how we teach HTA. And then finally, we have a sort of taster session on an introduction to HTA as well. So away from the university pricing structures, it's a more accessible, affordable taster. So that's us, our offerings.
Well, thanks, Eleanor and Claudia. I really like your reflection, especially also that you're quite reflective on your own program and what the focus of your own program is. You definitely say, okay, within our program, the focus is on methods, and I think by having such a competency framework, you are able to really reflect on your own program and see where you might want to adapt or what you might want to include. Not necessarily saying that you have to be comprehensive in that respect, but I think it really helps you, at least that's my take on it, and the same for you, Sa, is indeed what actually are we offering within the scope of HTA. And I really enjoyed the exercise, even if it's, like you said, not a systematic approach yet, but we might want to go in that direction and to see indeed how master programs or undergrad programs, which was also a question in the chat, could actually or are reflecting the competencies that are part of HTA. So thank you for this insightful presentation. I'd like to go to the last speaker of today, which is Andrea Alcaraz. She is currently the HTA coordinator and scholarship coordinator at IEX, the Institute of Clinical and Health Effectiveness in Argentina. And she's also a professor in the master's degree in clinical effectiveness master program at the University of Buenos Aires. So Andrea, last but not least, the floor is yours. Thank you.
Thank you, Vaya. Good morning, good afternoon. I'm happy to be here. I will try to describe our master program in a few minutes. The IEX has offered the Master in Clinical Effectiveness since 1999. We are an independent academic institution, but we are affiliated with the Faculty of Medicine at the University of Buenos Aires. The mastership has the higher accreditation status in Argentina, that is the CONEAU Category A. And the program provides training in quantitative and analytic methods for research, program implementation, and evidence-based health decision-making at national, regional, and global levels. The 2 years programs include 3 specializations: clinical and epidemiological research, health technology assessment and economic evaluations, and clinical management and quality of care in health organizations. So the students complete the core courses during the first year and specialization-specific and elective courses in the second year. The graduates must develop, present, and defend a master thesis based on original research. The classes are delivered online and in Spanish, with an in-person week in November in Buenos Aires. The master degree has more than 400 graduates from Latin America. So the focus of the program is Latin American students. So talking about specifically the HTA and economic evaluation specializations, it focuses on training students in the design, development, and interpretation of health technology assessment, economic evaluations, and studies on disease burden and quality of life. It emphasized decision-making related to the use of healthcare resources. So when we analyzed the framework, we saw that it could be used as a diagnostic tool. For example, in this preliminary analysis, we can see that the strengths of our programs are the core domains like clinical effectiveness, cost effectiveness, and stakeholder involvement that are really well integrated into the program. And maybe a weakness is the ethical analysis and legal consideration that could require further development. On the other hand, we identify some opportunities, for example, expanding coverage of emerging topics such as environmental impacts or artificial intelligence. It could be necessary to upgrade our program. So the usefulness for the program, it could be also clarifying the content depth. The framework could help the program to define the depth of each topic by establishing learning objectives across competent, proficient, and expert levels as the framework defines. Our program already incorporates different levels of complexity for each category of the framework. As example, in this analysis, we can see that we have a competent level covering essential concepts, for example, for ethical or organizational domains, but we have a proficient level in applying methods such as cost-effectiveness modeling, systematic review, or HTA reports, and the strong core of the program that it could be assessed like an expert level, that is the quality of evidence analysis. So we can see that one program is hard to fix in one category. We have different profiles of categories between different domains. So when I was thinking in this program, in this framework, I need to clarify that I am a professor in the HTA Master, but I am also the fellowship coordinator at IEX. So I've been working with the students for at least 15 years. And we also have a lot of other learning opportunities. This is, I'm sharing you the actual courses that go so very introductory ones, for example, for people that is having the first approach to HTA, maybe they work in a hospital or in a Ministry of Health, or they are trying to insert into the industry. And in the other hand, we have really advanced courses, for example, sensitivity analysis for Markov models. So we have, the blue ones are in Spanish, the orange one is in English, and the light blue is on demand. So I was thinking that the framework, it could be useful for alignment across educational offerings. By using the framework, IEX can better stratify its broader range of offerings, diplomas, short courses, that complement the master program. It could allow the students and professionals to select the most appropriate course based on their learner needs and career goals, and also to define career pathways. So the framework could help the master program to develop practical and advanced skills, preparing graduates for impactful roles in government, academia, and international agencies. This might enable graduates to contribute more effectively to policymaking, economic evaluation, and systematic review, addressing clinical health challenges in Latin America. So I was talking of the useful for us, but now I'm moving to capacity building in HTA. That was our second question, no? I think that the framework could support clear career program navigation, helping prospective students to identify whether they need an introduction to HTA, a deeper dive into economic evaluation, or advanced methodologies based on their professional goals. It could help the student to think, what do I need? Who teach what I need? So I think also that the framework could help tailor graduates' profile to better align with the expectation of potential employers. This would ensure that the student graduate with the specific skills sought by organizations in health system, international agencies, or private institutions. I think it could be really great if we can define for this position, we need this skill, and this program, it could fill this kind of skills. And also, because I was talking with you that we have a lot of student fellowship, we have a lot of partnership with other institutions. And I think that understanding or using the framework to identify well the skills that the students have, it could facilitate the international rotation, academic exchanges, and research collaboration, enabling students to gain global experiences and build professional network in the field of HTA. Because if we are all talking in the same language, we can say, I have a student that I need to get this particular skill. Could your institution give this training to my student? And the same in the other hand. And even when you work for a broad spectrum of countries, like in our case, because we have students for all Latin America, I think that having a clear understanding of which ability is given for a program, it could be great to talk the same language. So in conclusion, I think that the HTA competency framework could offer a structured path for enhancing the master program, strengthening academic excellence, and fostering globally competitive professionals in health technology assessment. And this is my contact information. So if you need some assistance, I can help you. Thank you.
Well, thank you, Andrea. And I really like your focus in your reflection that you come back to the purposes of the competency framework. And you say, okay, we can use it maybe for reflecting on our own training program, but we can also use this indeed for self-assessment by students or by professionals in defining the roles that are needed within our organization or within our team. So I really like these different perspectives in terms of the usefulness of the competency framework. Of course, we only have 3 minutes left, which is very, very few minutes. But my take on it is that all of you say, okay, you know, there are elements that really are very helpful that can improve our own capacity, our own training programs or educational programs, and we might want to see how we can internationally collaborate on trying to indeed share the same language in order to have indeed a quite clear view on the overarching competencies included in the framework. And like we said, this is work in progress. We do hope that we will have a validated framework by, say, the end of February. And maybe then we can take it from there and see if and how we, for example, as programs can work together in order to use it also in practice and to learn from each other in terms of how it works in practice and how we might improve it for the future. Having said that, there is one last question, 2 more questions, which I hope we can still pose. I think this is one question for Lisa. It's about the how to interpret it, the subject level or topic level of competencies. The question is, can the panel comment on the taken of competencies evaluation? Would it be different or would it be the same or similar? I think it relates to the different levels of expertise, Lisa. So how do you go about this? Is this per domain? Is this per competency within the domain?
Yeah, so the different levels of expertise are per competency, but it depends on whether it was already developed in the original framework. So if there was a proficient level, then we only develop the lower levels.
Okay, and then there is one other question, which is where are you implementing AI in HTA in the framework? I guess this means, will it be a separate domain or will it be part of another domain?
Yeah, AI is a separate domain, so we will include it in the framework like that, like in the processes of the domain, or the framework, sorry.
Okay, thank you. So are there any further reflections from my panelists? Is there something that you would like to say that we have not touched upon? I don't see any hand raised. So it's 3 o'clock. We see the time flies when you're having fun. I think it was too short. I'm sure we will continue collaborating in this vein. And I would like to thank you again for your participation and your fantastic reflections on the framework. This really helps us also moving forward. We will be in touch with each of you in the near future, but also those that have participated in the webinar. Thank you so much for your active participation. Please reach out to us if you would like to collaborate, if you want to learn more. We are very open to respond to any questions that you might have. And also thank you so much for HTI for hosting this webinar and for the organization. Well, stay safe and hope to see you somewhere around, but definitely, hopefully at the HTI meeting in Buenos Aires next year. Thank you.